According to Levinson and Malone, the authors of Pet-Oriented Child Psychotherapy, animals began being used to promote healthcare in the United States in 1953. In the last 5 to 10 years, however, comfort and therapy animals have become a popular fad, and pet therapy has been gaining traction as a valid therapy for depression. Questions still abound, however. How do pets positively affect the lives of people? Do those pets truly improve outcomes for patients with mental illness, such as major depressive disorder? If pet therapy is effective, can it be used to replace or at least reduce the amount of medication a person is taking to control their depression? Can it accompany or replace psychotherapy? We don't have the answers to all of these questions yet, but according to Kamioko and his associates, pet therapy does improve the outcomes of persons with major depression in conjunction with psychotherapy and pharmacotherapy. What that really means is that the pet therapy is working in conjunction with medications and psychotherapy. I wrote my capstone paper for my master's degree in nursing on pet therapy. I reviewed hundreds of articles and studies to learn about the effectiveness of pet therapy. As a person with major depressive disorder and a love for pets, I have a vested interest in this topic. So, what is major depression? Major depressive disorder is one of the leading causes of disability, and it is a worldwide problem that affects millions of people. According to the American Psychiatric Association, major depressive disorder includes symptoms such as depressed mood, anhedonia, which means lack of enjoyment, sleep changes, weight changes, psychomotor agitation or retardation. That means that people move slower or they move faster and more agitated. They might have feelings of worthlessness, fatigue, excessive or inappropriate guilt, indecisiveness, poor concentration, and of course suicidal ideation. The symptoms can cause significant distress or impairment in occupational, social, and other critical areas of functioning. The biggest problem, however, with major depressive disorder is the rate of relapse. Of those affected by major depressive disorder, the rate of relapse and recurrence ranges from 50 to 80%. That means that out of 100 people with major depressive disorder, 50 to 80 of those people are most likely going to have multiple episodes of major depression. Alternative options are needed to help reduce the rates of relapse for major depression, and pet therapy is one valid option. So, what is pet therapy? According to Kamioko and his associates, pet therapy is the introduction of an animal to the patient in such a way as to facilitate the safe and therapeutic interaction in order to promote a higher quality of life. Most frequently, dogs and cats are used for pet therapy, but there actually are a variety of other animals that have been used in the past. Those include horses, dolphins, birds, cows, pigs, rabbits, ferrets, and guinea pigs, just to name a few. Furthermore, pets have to be well trained to become pet therapy animals. I have a miniature Australian Shepherd who, during her basic dog training, showed a great temperament to become a therapy dog. We spent a lot of time, money, and work in her training, but she had some problems. Though she had the right temperament and personality to be a therapy animal, she also had severe anxiety and was afraid of many things, one of which was the car. She hated riding in the car, which is critical to becoming a therapy animal. She also had a lack of self-confidence that is required of therapy animals. This just shows that it takes many qualities to be a therapy animal. All factors must be right to have a dog that is able to provide comfort without stressing the animal. In the research, Kamioko and his associates performed what is known as a systematic review of studies. This means that they evaluated multiple randomized controlled studies to evaluate the effectiveness of pet therapy in treating mental illness, including major depressive disorder. A randomized controlled study is the best quality study you can get that shows very little bias. So in all of those studies that they looked at, a couple of them were a little inconclusive, but most of the trials reported that animal interactions with humans does reduce depressive symptoms. Still, pet therapy is not for everyone. Some people are afraid of animals, others have allergies to animals, and some have an immune-compromised system which makes it inappropriate for them to be around animals. All of those are reasons to invalidate pet therapy. Pet therapy, or the studies that were done for this also had some limitations. Most of the studies involving pet therapy had a limited number of participants, usually less than 50. Additionally, very few of the studies included an evaluation of the cost effectiveness of pet therapy. Finally, though the studies do show that pet therapy is effective in reducing depression, there were very few studies that assessed whether those gains would persist in the long term. So we really don't know if a year, 2 years, 3 years out, the benefits of pet therapy would still be present for those patients that experienced it. In conclusion, pet therapy has shown to help reduce depressive symptoms in many people. It has been validated as an adjunct therapy. That means that it can be used in combination with other therapies such as medicine and psychotherapy. More studies are needed for it to be used alone as a non-pharmacological treatment modality. Medications and various psychotherapy modalities are still the primary treatment options for patients with depression. Perhaps the future studies will place pet therapy on par with psychotherapy modalities. Thank you.